Headaches differentiation and diagnosis, case analysis. BB is a 27-year-old female patient who experienced frequent headaches lasting the past several months. Symptoms of a persistent and worsening headache started to occur more frequently and lasted for longer periods. She experienced vomiting, nausea, blurred vision, and light and sound irritated her, while the problem disappeared only during sleep. Physical examination of the patient showed no damage to the brain. Temperature and blood pressure appear to be satisfactory. BB's headaches could be caused by the stressful environment, related to graduate school and a waitressing job, as well as a family history of headaches. Considering all information gathered during the examination, it is critical to differentiate the condition among a cluster headache, tension headache, or migraine headache. A cluster headache is a rare headache disorder that can be characterized by short but severe headaches. Its symptoms are easily identifiable: recurrent attacks of unilateral pain, usually involving the orbital and periorbital region, associated with local autonomic symptoms on the same side. Other symptoms include watery eyes and a runny nose. It often occurs with a seasonal pattern. Since BB's symptoms are described differently, cluster headache is eliminated. A tension headache is usually characterized by muscle contraction around the neck and head. A patient might feel tightness and pressure in these areas. Tension headaches are less harmful as they do not necessarily interrupt daily activities, and do not affect vision, breathing, or blood pressure. It can occur because of stress, hunger, consumption of alcohol, or other environmental factors. A tension headache is eliminated for the same reasons. Main symptoms do not include vomiting, nausea, and blurred vision. A migraine headache is found to be one of the most common neurological disorders accompanied by severe headaches. Primary symptoms include sensitivity to light and sound, nausea, and vomiting. Often migraines are diagnosed late because people do not pay attention to mild headaches. Therefore, migraine headaches without proper treatment can quickly become chronic. In the case of BB, she has experienced stable character headaches and other apparent symptoms of a migraine. The goal of migraine treatment is to improve the quality of life by reducing the number of headaches and other symptoms. Treatment for a migraine usually consists of preventive therapy and acute therapy. The latter provides rapid and definitive relief. Oral intake of nonspecific drugs is the primary acute therapy treatment for a migraine. They include OTC drugs like aspirin and paracetamol. Among other drugs proven to be effective are acetylsalicylic acid, ibuprofen, diclofenac, metamizole, and more. However, with often headaches, people tend to overuse these drugs, and the effect becomes less tangible. There are also specific anti-migraine drugs that are more effective and act longer but have greater adverse effects. For instance, various types of triptans are considered to be highly effective. The treatment plan depends on the patient, intensity of headaches, tolerability, and availability. Effective drugs are also used for prevention. Calcitonin gene-related peptide, CGRP, has been proven to be useful in the prevention of migraine. However, some researchers also suggest spinal rehabilitative exercise and manual treatment for the prevention of migraine attacks. Thus, BB is diagnosed with migraine headaches. She can be prescribed the triptan drugs depending on her tolerability. Manual treatment and CGRP could be used to prevent migraine.